Mr Secretary, good morning. What do you understand to be the health of the Prime Minister at this time?
Well, good morning, Nick. The Prime Minister, as you know, has suffered from persistent symptoms of coronavirus for 10 days now after he tested positive. So on the advice of his doctor, he went into hospital yesterday. This wasn't an emergency admission. It was a planned admission to undergo some routine tests. He spent the night in hospital. And, of course, we all wish him well. Indeed. And hope that once he's had the tests, he can return to number 10 as soon as possible.
Will he be conducting video conferences from the hospital?
Well, at the moment, I imagine he's having the tests, but he does remain very much in charge of the government. He will be kept updated as to what's going on over the course of the day. This morning, the Foreign Secretary, Dominic Raab, will chair the morning meeting on COVID, which happens every day. But the PM remains the Prime Minister, and I hope he's back to work as soon as possible.
And lastly, on the case of the Prime Minister, do you have any idea when he might be out of hospital, Mr Jenrick?
I don't know that. That will be a matter for his doctors. But knowing the Prime Minister, I'm sure he'll want to get back to number 10 and back to work as quickly as he can.
It's interesting you say he'll want to get back to work. There's a sense that the nation wants to get back to work. You've probably seen, or hopefully one of your colleagues has told you, that one newspaper tells us the nation is losing £2.4 billion a day, output cut by more than 30%. This can't go on forever, Mr Jenrick.
No, well, the primary focus of the government is obviously to save people's lives, and so our strategy is to flatten the curve, ensure that the NHS has the capacity to treat people appropriately. But we're very conscious of the significant economic cost, and that's being borne by people right across the country. People who are concerned about their jobs, people who are being furloughed onto our new scheme, business owners who are worried about how they'll pay the bills and how long the emergency measures will last for. We're not taking these measures lightly. We're doing so on medical advice in order to protect the NHS and to save people's lives. As soon as we're able to ease the measures, we will do so, but clearly we'll need to do so on advice and in a very careful way so that we don't see, as we have seen in some other countries, a resurgence in the virus.
And for guidance for my listeners, are we talking, at least another 2 weeks, 3 weeks, 4?
Well, we said when we implemented the measures that we would review them in around 3 weeks' time. So we said that Easter would be the first point in which we would consider them. But clearly, we will need to think carefully about where we are in the passage of the virus. And it does seem as if we're now heading into the most difficult couple of weeks. It's difficult to be precise as to when the peak will come, but it's going to be in the next few weeks. And so at the moment, all our efforts should be focused on adhering to those measures, ensuring that we all play our own parts in our daily lives, staying at home, protecting the NHS and saving people's lives. But as soon as we're able to, we will obviously begin to lift the measures in a sensible way, and we're already preparing and analysing how we might be able to do that.
Will it be by age groups?
Well, we will have to give that further thought, and we'll have to take medical advice before bringing forward those suggestions. At the moment, I think it's too early to say that, because clearly at the moment we're still in a very serious situation where very large numbers of people, unfortunately, are being infected and sadly dying. And so this isn't the moment to let up at all.
One of your briefs is local government. Do you agree that some local parks are being shut?
Over the weekend, a small number of councils did choose to close parks. I've spoken to some of those councils. It's obviously a decision for them, and they say that they took it because the parks were overcrowded. They couldn't enforce the social distancing rules, and a very small minority of people were breaching them quite flagrantly by congregating or having picnics and so on. My message to them is obviously to use their powers judiciously, because it's very important.
Well, are you in favour of closing parks?
Minister? I don't want to see parks closed, but neither, I think, do the councils who've done so. They've done so because they felt that they couldn't enforce the social distancing rules. And at this moment where we are approaching the peak, this is the moment in which we should all be following the guidelines and staying at home. And when we do go out to exercise, doing it with our household for a short period of time, walking, jogging, not congregating. And so I would really urge people in the next couple of weeks. I know it's tough, particularly if you live in a flat, particularly if you've got a family. It's very difficult. But please follow those guidelines and don't ruin this for other people.
But the Health Secretary indicated that possibly exercise could be outlawed, could be restricted. Do you agree with that?
Well, we don't have any plans to do that. But if we need to bring forward stricter measures, we obviously will have to consider that. But we desperately don't want to do that because obviously we all need to remain fit and healthy. We've got to protect our mental health, and we've got to be conscious that not everyone obviously has a garden. There are millions of people.
Many people are living 15 stories up in a busy city such as London,
absolutely.
And they need to get their children out. They need to, Mr. Secretary.
Absolutely. I've got kids. I know what it's like to be cooped up inside. People want to get out, but that's why I'd really urge, particularly if the weather continues to be good, particularly as we head into the Easter weekend, please respect the guidelines. Then the sooner that we do that, the more we'll be, the sooner we'll be able to consider easing them. So there is, I think, as the Queen said last night very powerfully, this really is one of those rare moments in our lives where we're all in a collective endeavour. We all can influence events, but we've all got to play our part.